For introduction, I'm Dr. Osborne, and Miss Taylor, our nutrition tech, and I have put together a gut health talk for this evening, and it's really to just give you more information about it. We've been getting more and more information about nutrition and how to help people, and the gut health is really coming to the surface as being one of the most important parts of nutrition. Getting the testing done, and then getting on the right products, the right food, the right diet, because your gut health, as we'll discover in a little while, affects everything. We wanted to talk mainly about energy, immune system, and anti-aging. There really isn't anti-aging. It's slowing down the aging process or not allowing it to progress faster than it should be. But the buzz term is anti-aging in today's world. So just a little bit about me. Obviously, I've been a chiropractor for 30-some years now. And I have to think it's been about 8 years ago now. About 8 years ago now. I'd always been very healthy, very vibrant, had an incredible immune system, and I got to the point where I actually thought I might be dying. I didn't know what was going on. Depression, anxiety, chronic fatigue, no get up and go. I've been a go-getter all my life, and I just wasn't me at all. And so I obviously have the access to all the great chiropractic care that I can get, and other health professionals, and nobody could seem to figure out what it was. I finally went to someone who specialized in nutrition, and she figured out that I had Lyme. And because of that, my immune system was run down, my digestive system was a mess, it was affecting my heart, and on down the road. So that really is what started me in the process of getting well and getting healthy again. And so that's when I really started studying nutrition and how that can be affecting us. And what I've learned over time is that in today's environment, the level of the nutrition in our food, the toxins that we take in, everything is affecting us, and it's certainly affecting our gut health. But here's what we're finding out, whether it's hormonal issues, even brain fog, things like that, it really comes down to the gut first. And if the gut is not working correctly, it can be causing problems all over the place. And autoimmune disorders, you guys have probably heard of that. It's a very common thing now. It might be more of a pandemic than COVID of what's going on there. But cancer, heart issues, liver problems, fibromyalgia, chronic fatigue, rheumatoid arthritis, brain fog, memory issues, it really all comes down to the gut. And the gut is the core source of inflammation. And you guys have probably heard that. The big no-no is inflammation. Inflammation is the start of every disease process. Well, if the gut gets inflamed, then it's going to start causing inflammatory processes all over the body. So what are we going to cover tonight? Well, how your gut affects your health, your overall health, your energy levels, your immune system, aging, your brain, and we're going to talk some about the testing and what that looks like, the type of diet you should be looking at, SRT, that's stress response testing, we do here in the office, and that's another form of testing we do, and what can you do about it?
What is SRT?
Okay, stress response testing, and we're going to talk about it a little bit later to let you know what that is. But good question, because that's not a common thing out there, right? So we're going to look at that, and obviously the types of testing from the SRT. We have blood testing, we have stool testing, and kind of gross to think about, but the amount of information we get from that is amazing. So here's my corny joke of the night for you, is this is going to be the crappiest talk I've ever given, okay? So A GI ecology, or your microbiome, eats what you eat. So the microbiome, what is that? That's essentially all the little microbes and pathogens and bacteria that are in your gut. Okay? And there's millions of them in there. Okay? But they have to stay balanced. That microbiome's kind of like a community. Okay? And so that community has to stay balanced. Just like our communities have to stay balanced. And so the microbiome, when we say that word tonight, that's what you can think about. It's just the environment in your gut. Okay? That's what's living in there. And it's kind of weird to think about that, but we have millions and millions of living things in our gut, and they have to be there for us to be healthy. And we'll learn a little bit more about that. So that's what the microbiome is. And there's trillions of microorganisms out there. There's between 15 and 36,000 different species that can reside in your gut, and they have to be in balance. And we'll talk about it a little bit more, but later on. But just our toxic environment and the foods we eat, the drugs that we take, all those things come into play, and it makes it very, very difficult for your gut to stay balanced. So, dysbiosis, there's a new word for you. So if you haven't heard this before, what is dysbiosis? Well, biosis is going to be that microbiome. Dys means it's out of balance or it's not working the way it should. So dysbiosis is an overgrowth of one or more of the favorable microbes, yeast or other organisms, a lack of the friendly flora that we should have, kind of in the neighborhood called the microbiome. So what's in the neighborhood of your gut? There's got to be good guys, there's got to be bad guys, there's got to be the organisms that are supposed to be in there, and they have to be in the right balance for it to work correctly. And a big thing in today's world of nutrition especially is probiotics, right? Everybody's heard of probiotics, probably have taken probiotics at some time in your life. But the big thing with probiotics, our guts are so messed up that almost anybody that takes a probiotic will say that helped. But sometimes that is not your best friend, because we will actually do the testing and find out that you have too many of the good probiotics in your system. And by taking more and more probiotics, it's the good guys, but it's throwing it out of balance in there. And we have to maintain balance in there. So there's a lot of things that we could talk about, but most people understand fungus or yeast or what is called Candida albicans. And so we're gonna talk about that one tonight. This could be any of those 15,000 species that we could pick out, but this one is very, very common. And so it's a normal fungus, okay, Candida or yeast, right? It's in breads, it's in other foods we have. When it's in very small amounts, that's great. But yeast is opportunistic, right? So you put yeast in an environment where it can thrive, and it does what? Exactly the same thing as when you put the yeast in the bread dough and warm it up, and it just multiplies and multiplies and multiplies. So people get Candida, excuse me, into their system, and then it starts causing problems down the road. So essentially, it's the human body, 98.6 degrees, moisture, sugar, and what happens, right? We're like a human petri dish, okay? And so that yeast can multiply and multiply in there and cause problems. So when you get a Candida overgrowth or infection, if you will, like I said earlier, it can affect everything. It's not just your gut. It's not just women getting yeast infections, the female organs. It's not just getting athlete's feet on your toes, or your toenails getting fungus on them. This affects your brain. It can cause food sensitivities, digestive problems, liver problems, itchy, dry skin, obviously, like thrush, you've maybe seen people that have the white tongue, bad breath and a white tongue. That's candida. And as I said, athlete's feet, vaginal infections that go along with that. The gut-brain connection. This is another thing that's really coming to the forefront in healthcare today. And they are now calling the gut the second brain. Okay? And the reason for that, the gut, the microbiota, the neighborhood, the microbiome plays a vital role in not only physical but psychological health because of the neural network. There's a neural network called the enteric nervous system. So a lot of us have heard of the central nervous system, the spinal cord, and the brain, and then the peripheral nervous system. But there is an enteric nervous system. It's got about 100 million nerves found lining the gut. So there's a ton of information being sent out and exchanged and controlled by the gut itself that affects your immune system, that affects your thinking, your brain, really all of your physiology, and affecting your brain obviously can affect your psychology. And so the gut-brain connection is a big factor that comes into this, even when we're talking about just candida in the gut. So it's opportunistic, right? So candida is a fungus. It's everywhere. It's there in small amounts, but it is opportunistic. And what does that mean? Just like any other virus or bacteria, that if your immune system is down and your body is creating a haven for that, guess what? It's going to take up residence, okay? It's like a squatter, okay? It's not leaving. It's not leaving because it's got a good environment, things are good, and it's going to be there. So under certain conditions, whether it's fungal, bacteria, viral, whatever it may be, it can occur and proliferate in excessive amounts. When it gets in excessive amounts, that's going to lead to obviously digestive problems. People can have diarrhea, constipation, other digestive issues, but itchy skin, vaginal yeast infections recurring, nail fungal infections, and the list goes on and on. But what creates this environment? Why do we have this environment going on? Well, chronic food sensitivities. All right? Believe it or not, everybody sitting in this room, no matter how great your diet is, probably has a food sensitivity that you don't even know about. And it may be an extremely healthy food, or what's considered an extremely healthy food, like beets or lettuce or asparagus. And guess what? It's causing inflammation in your system because you have developed a food sensitivity to it. Maybe from just eating too much of it, maybe because you do have some leaky gut going on that we'll discuss in a few minutes. Antibiotics. Okay, antibiotics ruin your microbiome because we get whatever infection, the doctors put you on antibiotics for that, and that's fine. It may have taken care of whatever other bacterial infection you may have, but at the same time it destroys a lot of the good microbiome in your gut, and now it's out of balance. So many times you'll hear people, I was on a course of antibiotics, and then a month or two later, now my digestive tract's all screwed up and I can't figure out why. And so that's what's going on. In fact, all medications have some effect on that microbiome. High sugar, refined carbs, and lectins. Well, we're in the US, so no one in the United States has a high sugar and refined carb diet, right? So we don't really need to worry about that. Toxins. I'm just here to tell you, we live in a toxic environment. Even when you're buying the best grade A organic that you can buy, it's still leached in there. Okay? Our good old friends at Monsanto with the glyphosates, it's everywhere. They have went up into Antarctica and did the ice plug thing and brought it back and tested it and have found glyphosates up there. Okay, so it's in our environment. It's in the ground, it goes up into the clouds, it rains, so it's everywhere. So besides all the other toxins that we have going on, our good old weed killer is getting into all of us. And high alcohol intake, a weakened immune system, taking oral contraceptives can cause a lot of microbiome problems. And then certainly diabetes and high stress levels. And again, no one has any high stress in today's environment, right? Tiredness and fatigue, talking about the energy. Okay, one of the common symptoms of candida is fatigue, or gut imbalance is fatigue. And though they don't have a lot of scientific studies on that, we see it in practice. We see this on an everyday basis. But the yeast can be associated with nutritional deficiencies of vitamin B6, essential fatty acids, magnesium, just to name a few. So think about that. If you're not getting your vitamin B6 because the candida is causing it not to be absorbed, or for whatever reason causing a deficiency in that, do you think your energy levels are going to be down? Mm-hmm. Yeah, absolutely. And when you start taking away essential fatty acids and magnesium, you're really messing with your energy cycles. Low functioning immune system can contribute to being tired and fatigued. There's no doubt about that. And one study even suggests that prolonged candida of the gut may even be a potential cause of what we call chronic fatigue syndrome that people get. Digestive issues, that goes without saying. The health of your digestive system relies heavily on the balance between the good and the bad microbes in there. So they both have to be there. We can't just get rid of all the bad ones. Okay? They have to be there in balance. It's like they work in congruency with each other and have to stay balanced in there. And so when they do get imbalanced, obviously we get digestive issues, from constipation, diarrhea, nausea, cramps, bloating, and so forth. Overgrowth is associated with several diseases of the GI tract, couple Crohn's, ulcerative colitis. And so these diseases that they don't know what causes them, or it's genetic, many times can be associated with having the microbiome out of balance. Come on. There we go. So, what does this all get us to when this is out of balance? Well, has anybody heard of leaky gut? Okay. So, what is leaky gut? Well, I'm gonna keep it as simple as I can for you, and this is a great illustration here. But essentially, you normally have really tight junctions between the cells in your gut wall, and this is where all these tiny particles, once it's broken down, is supposed to get in your vitamins and the nutritional components that you need, and they go in and they go through this filter, if you will, and that's what should get into your bloodstream. Well, what happens when this gut gets leaky and inflamed is these tight junctions are opened up, and now guess what's getting in here? Larger particles than should be in the bloodstream. Mm-hmm. Well, when a particle gets in the bloodstream, whether it's a virus, a bacteria, or a food particle that's not supposed to be there, what does the body do with that? It's an immune response. Because the body's like, this is not supposed to be there. I'm going to send out my lymphocytes, I'm going to send out whatever I need. I'm going to activate the immune system, or that cytokine response. And when that's activated, and it happens over and over and over again, what do you call that when your immune system won't shut down and it's running all the time? Autoimmune. So that's where we get into autoimmune situations with this, because people have leaky gut, and now everything they eat, they're becoming allergic to, because it's going into the body and the body's creating antibodies for it and going, oh, there's broccoli again. We're going to kill broccoli. Okay? Doesn't make any sense, but that's exactly what's happening. Your body doesn't treat it any differently than a virus or a bacteria that's not supposed to be there. So that's how we get into all these autoimmune situations, and obviously inflammation, and then we get malabsorption and nutrition deficiency. And here's the leaky gut syndrome cycle. So we get intestinal inflammation and gut of the gut lining. Then we're going to get malabsorption of the nutrients. This says B12, magnesium, iron. We're going to get an immune response from the body. That creates GI issues and multiple food intolerances or sensitivities. That leads to autoimmune disease, which does what? Inflames the gut lining even more, and around and around and around we go. And that's what's going to lead to chronic inflammation of the gut, and that's going to eventually lead to chronic disease states down the line. So, like I said earlier, the gastrointestinal tract, home to trillions of microorganisms, 15 to 36 species in there. And each individual is estimated to host at least 160 different species. So, you didn't know that you had all that going on in there, right? And so that essentially, they're calling that now, it's like a separate organ in your body. We all talk about the stomach, the heart, the lung, the liver, the kidneys being organs, right? Well, the large intestine is an organ, but inside that, what's operating in there is like another organ itself. So just like if your lungs get out of balance, it's going to have problems, right? So when this organ gets out of balance, then we have major problems going on in there. Gut microbiota is principally acquired during birthing and matures during infancy. It evolves during childhood, and then it starts changing as we age, just as every other organ system in there. And so now we're talking about the aging, or slowing down that process so that it's not going at a high rate of speed, right? We're all aging, but how can we keep that going as slow as possible? So here's what happens. As you're aging, we'll get diminished stomach acid production, so we're not digesting our food as well. We get increased gastric pH, so a more basic system. Delayed gastric emptying, okay? We don't move quite as good, right? We don't move as good walking down the hallway, and inside doesn't move quite as good as it did. So we get decreased gastrointestinal motility, and all of these can negatively affect the microbiota. Now, couple these together with a lifetime of a poor diet, repeated exposures to antibiotics, a lot of non-steroidal anti-inflammatory drugs, right? Okay, aspirin, Tylenol, ibuprofen, and laxatives contribute to a shift in the gut microbiome from diverse and balanced to dysbiotic, or way out of balance. And this is just kind of a nice chart that shows over here from birth, the weaning period, infancy, adult age, and the golden age. And you can see how these different things change. Bifidobacteria is the good guys, okay? That's what we want. You can see that this spikes up at birth and then stays pretty level here till we start aging, right? And that starts to go down. So we start to lose the good guys, all right? The bacteroids, these go up and stay up there across the board. They're there. Clostridium, that is not a good guy. And it comes up, it stays right there, and then what happens is we start to age. So the bad guys start growing, the good guys start coming down as we age. So that's aging of the gut, if you will, or aging of the microbiome. So what can we do to try to slow down that aging of the gut? And again, that's the gut wall permeability comes into that leaky gut syndrome. And so as we age, we're more and more susceptible to having gut lining inflammation, to having leaky gut. But there's ways we can combat that. And so when it comes to inflammation or anti-inflammation, your lifestyle, nutrition, gut microbiota, and its metabolites all are a part of that, okay? So the more inflamed you are, the more you're going to be disabled, more frail, and go into age-related diseases. The more anti-inflamed you are, the more successful aging and the longevity comes into play. So one of the most important keys to healthy aging, or slowing down that aging process, that longevity that we look for, is to develop and maintain your immune system that minimizes chronic inflammation. Okay? Now, inflammation's not a bad thing. Okay? If you sprain your ankle, it's going to inflame, and it should. Okay? But that's acute inflammation for that injury. You have the cytokine response, and the body triggers everything to come in to help repair those tissues. But when it's chronic, it's a bad thing. When it's chronic inflammation. And it's kind of like, water. Is water a good thing? Yes. But what if water comes and stays and just pools there all the time? What do we get? Rot, right? And so that inflammation is rotting things when it's there chronically. And so what we want to do is try to get you like the people that live to 100 years old. And what they have found with that is they have a well-conserved immune system, and despite showing some inflammation markers, they avoid or delay major inflammation-driven and age-related diseases because they're controlling this. Here's another great chart. Probably hard for you guys to see, but there's our friend Bifidobacteria again up here in the blue, and other is in red. Look early in life where we're at. The Bifidobacteria is where? 60 to 70%. As we start growing in that, it's 30 to 40%. As we get into later adulthood, 10%. And as we get into old age, it's down to 5%. So, would it be a good idea for us to look at this and go, how can we possibly keep that blue mark, that Bifidobacteria, how can we keep that at a greater level in there? So, that's kind of the give you the information on the gut. I know we went through that quickly, but that tells you what's going on in your gut, the microbiome, and how that's affecting possibly leaky gut and your immune system. So what we say about these things is we don't guess, we test.